Hello, I'm Dr. Depeshnev-Sarya. I'm a practicing pediatrician and the director of the Wisconsin Early Childhood Health Consultation Project. Often in clinical practice, I'm asked by families, when can my child go back to their early childhood setting or preschool? This is usually being asked with an expectation that as a medical professional, I have to sign off on this or certify that they're okay to go back. The reality is, there's actually three different people or groups of people that are involved in the decision about whether a child can go back or should go back. Certainly, there's medical professionals like myself. We can look at a child and say, is the condition that they have, is going back a threat to their health or to the health of other people, whether it's children or staff? That's an important question. We're happy to help with that. But there's two other people involved. There's also the parents. Parents know their children best and can judge, is my child just going to be miserable being somewhere that's not home? How are they going to do? That's something that they can assess. Also, that family can also think about their own circumstances. A mildly ill child who doesn't pose a threat to anyone else or themselves may be okay to go back, particularly if it's important to that family. Not all families have the privilege to take additional days off of work, and it can actually be significant for them economically if they're not allowed to do so. And then finally, there's the center itself. Only the center can judge whether they are able to care for a child that might need some extra care. Some kids, when they're not feeling well, need extra holding or extra attention. They may just be emotionally not as stable as they might otherwise just because they feel yucky. That can pose a threat sometimes to the ability to care for other children. If there's 10 children in a room and 2 teachers, and one child is taking up one teacher's time, well, then that leaves one teacher to care for the other 9. That can pose a challenge as well. And that's a legitimate reason for a center to say, your child needs more care than we can reasonably provide at this time. So what I'm really trying to say is that it's not my decision, it's not me signing off or certifying or any other healthcare professional. It's really a shared decision. Each of these groups has one part of the puzzle, so to speak, that'll get us to that answer, should this child return to care? And I think when we think about it in that way and frame it in that way, then we come at a really good set of answers that keep the child at the center of all we do. Thank you.